Welcome to another interesting edition of our current affairs program, Issues of the Moment. Issues of the Moment is coming to you from the stable of Living TV, Abia State in southeast Nigeria. And your regular anchor, Chinagozi. On our program today, we are going to focus our attention on primary healthcare system in Abia State, southeast Nigeria. Our guest today is the Executive Secretary of Abia State Primary Healthcare Development Agency, Dr. Chinagozi Adindu. Dr. Adindu, welcome to the program.
Thank you very much. Viewers, you're welcome about.
Let me start by congratulating you on your second tenure in office. Okay, let us start this way, Doc. Like I said, this is your second tenure in office. Now, how has it been piloting the affairs of the agency?
Thank you very much. Yeah, as a matter of fact, it has not been easy. But the good thing is that we are focused and we are determined to succeed. The State Primary Care Development Agency came into being in the year 2015. And from then till now, it has undergone several metamorphoses. We've been able to actually put certain things into proper shape. Yeah, of course, we know that by virtue of the law, enabling the establishment of the agency, we are in charge of the local government health authorities and the 772 primary health care facilities in Abia State, in addition to the over 5,000 workers. So it's an onerous responsibility, but we have risen up to the expectation that today we've been able to have some interesting achievements that are on record. For instance, Abia is one of the states in Nigeria that has fully moved. We have transformed. There is now what we call a primary healthcare under one roof. A situation where you now have your own primary healthcare workers. You have your structure. At the national level, we call it the National Primary Care Development Agency. At the state level, we call it the State Primary Care Development Agency. At local government level, we call it the Local Government Health Authority. At the political ward level, we call it the Ward Health Development Committee. At the village level, we have the Village Health Committee. So it's a complete structure. The direction, the procedure, the reporting, follows that same pattern. Yeah, so today we have that arrangement, and that has enabled us to have one policy, one plan, and one monitoring and evaluation mechanism. So it has been assisting us, and today too we've been able to look inwards. We started by undertaking what we call the baseline assessment of all the facilities. We took into cognizance the resources at our disposal. Look at the infrastructure. We looked at the human resources. We looked at the equipment available, services to be rendered. So we had to categorize these 772 health facilities into three categories. We have the one we call the primary healthcare centers, ward health centers. So every political ward, we identified one major health facility. And then we have the ones we call the health clinics and the ones we call the health posts. Now for the workers, we discovered that they were kind of dejected, disillusioned, and disenchanted with the entire system. So we had to work on their psyche to ensure that they will perform optimally. So we had to pass them through some levels of ethical reorientation, refresher programs, capacity building workshops. And since we came into office till now, we've been able to organize 123 capacity building workshops for different cadres, different categories of healthcare workers. So that is now that it's a CIism. They are now so happy to give in their best. That is why we are getting results. So in the area of funding, His Excellency the Governor is a health-friendly governor. He has been assisting us. He came to our rescue by paying counterpart fund to some of the development partners and donor agencies. And today they are here in the state working with us. He assisted us to attract the health policy.
You said that we have 772 health centers in Abia State.
Yes.
And it is well known the world over that Nigeria has a weak health system. How equipped are these health centers?
All right. Well, obviously, they have undergone years of abandonment. They've not been taken good care of, but since we came on board, we've been able to inject blood into it. It is on record that 65% of our healthcare needs, our health challenges are handled at the primary healthcare level. 65%. That is on record. We are scattered everywhere. So we've been able to renovate some of these facilities. As of today, we've been able to renovate 243 primary healthcare facilities. So we will still continue, at that to ensure that all our facilities are functional. In the area of equipment, His Excellency, the governor has been assisting us. The other time, we received about 4 container loads of medical equipment from the diaspora group. They assisted us, and we distributed that to the primary healthcare centers. He's been assisting us to buy equipment, basic medical equipment and essential drugs, and we've been making them available to these health facilities.
Okay, you also said now that in Abia State, 65% of health needs are being handled at the health centers.
Yes.
Now, but it's also on record that some Abians don't have confidence in the health centers. When they are sick, they prefer to go to the tertiary institutions. So, don't you see that it's a contradiction?
No, it's not. Those who go to tertiary, we handle diseases at the primary level. Then we refer to secondary and then to tertiary. But there is this thing that has to do with name and then position. Okay. Most people think because they've arrived, for them to tell you that they've arrived, when they have headache, they go to FMC. So that is a problem with that. But then the bulk of the people, we are talking about 773. FMC is just one in the state. Absolute is one. And then general hospitals, there are about 14 of them. So majority of our people go to these PSCs. It is just at the next door. If you go everywhere, 3-kilometer radius, you will feel our presence. So if you harness the records, you will understand what I'm talking about.
Okay, it's also well known that health personnel, they don't like working in health centers, especially those in rural areas. What are you doing to correct this impression? Or is there a positive change of attitude on the part of the health personnel?
Yeah, they have their reasons. One is the problem of security. 2 is the dilapidated structure of the facility. And then the third one, most of the health centers are located at the places that are very, very far from residential houses. So we have decided to involve the community in what we are doing. We have this arrangement called community participation. That is the essence of having these ward health committees and village health committees. So we work with these people to make sure we bridge the gaps identified. So our people can now work, and of course we have what we call the rural personal allowance, which most people benefit from. So instead of you staying in the urban area where you do little or nothing, you go there and then you receive this rural personal allowance, and then some of the gaps identified can be handled by this. They are being handled by these village development committees. There are so many people in the rural areas. They provide accommodation for our health workers. I say, live here, it is close to your center. Okay. If you are afraid to live in the health center, come to my house and live. We have that arrangement, so that anybody that comes to the center, they will easily notify her, the health system in charge or that staff of that facility. So with that arrangement, it's been working for us. And then we also have a situation where members of the public, the members of the community will come together and say, no, this is our facility, we need to do something. Yes, government have been trying, but we will equally put in our own like in Amuzuku here. I remember there's something we call Basic Care Provision Fund. I used to give to all the World Health Centers. We give them like 300,000 every quarter to help them buy drugs. Okay. So when we gave them the last tranche, good thing, the chairman of the village health committee went to his people and said, this is the money we got, want to apply it into this. And they look at the center and said, no, this money won't be enough. And the community raised up to 3 million. And today, go and see the wonderful structure they have there.
That's encouraging.
Yes, so many other communities are doing that. So that is what we want. we have that arrangement with the community. Community participation is an integral aspect of our program.
Okay, what is Abia State Health Development Agency doing differently when compared with its counterparts in other parts of Nigeria?
Well, that's a very interesting question. You know, the State Primary Care Development Agency is saddled with the onerous responsibility of harnessing resources from individuals, communities, government, NGOs, partners are using SEM, effectively for the sustainable protection of our people from avoidable diseases and death. Because of this, our community participation aspect has been assisting us. I have so many of my friends. Once I reach out to them and say, look, you need to own this health facility, do something. And they are doing. Since I came into office, I've commissioned 65 new health centers. Next month, I'm going to commission 3. I have already built 1 for my community. I'm encouraging my friends. They are building for their communities. So in some other, they may wait for government to do it for them. But through our association and meetings with clubs, age grades, they've been assisting us to get these things done. That's one. Secondly, in the area of funding, we go out of our way to reach out to others. We don't just wait for government. We attract, like last year, we were able to attract coaching equipment. We call it direct solar drives. Okay. 236 pieces. Each of them is worth more than 10 million. And we've distributed that too. So without disturbing government per se, we go out of our way. So that is, we do some of these things. And in some other states, you may not be so lucky. Then the other one is we have what we call the advocacy core group. I have this meeting made up of key religious and traditional rulers with people representing various media houses. So anytime we have any program, I reach out to the advocacy core group. They will now, release the information, to their people. Before you know it, everybody will participate. That is why we now have over 100% coverage in our immunization campaigns and some of our other activities. So we have that unique arrangement. The advocacy core group is really assisting us. Another thing we are doing differently is this award and reward system. If you are not doing very well, we don't take chances. We sanction you there and then so that others will learn from them.
Yes.
So all the erring staff, we don't treat them with kids' glove. We make sure we met out the needed sanction. And for those who do well, we encourage them. We give them prize. We give out gifts. We, make them feel happy that they've done well. So it's a kind of motivation. And so our people are now working hard. There's a kind of competition at the end of the quarter. You say, this IGA came first in family planning. This one came first in immunization. This one came first in deliveries. The number of deliveries, from available data from this IGA is high. So they feel happy. And there is that competition, healthy competition. So these are some of the things we are.
Okay.
And the fact it's rubbed off. Last year, I think you are aware, after the organization of donor partners and agencies in the country with National Primary Care Development Agency went around all the states, they did a kind of survey. Okay. And at the end of the day, they were able to come up with the verdict that the chief executive, the executive secretary of Abia State Primary Care Development Agency,
and that's you,
is the most outstanding performing executive secretary, and they gave me this award. Okay. Just 2-3 months after that, I also won another one as the best civil servant in Nigeria for the year 2021, civil servant of the year, by the African Union and some other organizations. So I think my people, we've been doing well, as a state, the State Primary Care Development Agency.
Okay, thank you very much. You are watching Issues of the Moment. At this point, we are going to take a break, and when we come back, the rest of the program continues. Today, we are taking a look at the activities of Abia State Healthcare Primary Development Agency, and our guest is the Executive Secretary of that very agency, Dr. Chinagozi Adindu. Stay tuned.
Living TV, bringing the world first to you.
Welcome back to the program. You are watching Issues of the Moment. And our guest today, like I said earlier, is the Executive Secretary, Abia State Primary Healthcare Development Agency, Dr. Chinagozi Adindu. Now, Dr. Adindu, can you give us an update on the ongoing immunization exercise in the state?
Yeah, thank you. Immunization is a potent tool that we are using to combat, to make sure that we reduce the spread of vaccine-preventable diseases ravaging the environment. For us, we have so many antigens that we are using. The one we are combating mostly now is the COVID-19 scourge. We have done what we call the SCALES 1 COVID vaccination campaign. We are done with the SCALES 2. Today, we are now facing the optimized SCALES 3 strategy. This one is a 3 months campaign exercise. The updates so far in Abia State, we've been able to vaccinate 28.3% of eligible persons. So it's still a far cry. We want to achieve at least 70 so that we can talk about having herd immunity. So one thing about this disease is that the causative organism, severe active respiratory syndrome coronavirus type 2, mutates. It changes its shape. That was why we had the first one. First strain we call the alpha strain. After a while, the second one came, we call it the delta strain. And then we had the beta strain. We had the Omicron. You remember our friends in India, they refused to take the vaccines. But then when the Omicron came,
yes,
the fourth wave, they were recording over 200,000 deaths daily. So they now saw the need for them to. I don't want the same thing to happen to us here in Abia State and in Nigeria. If it will be possible, our people should try as much as possible so that we can record up to 70% and have what we call herd immunity. So that size is still on. We are going to flag off this third phase called the SCALES 3.0, and it will last for 3 months. We will be on every day. COVID-19 vaccination will be on. We will create, we call the special sites. We have our traditional health centers, health institutions. Then we also identify some public places where people can go and get vaccinated. So the exercise is on, and we are encouraging our people. It is effective, and it is free. So we shouldn't listen to those people that are peddling rumors, unfounded stories, what we call conspiracy theory. It shouldn't deter us. We should come forward and then get vaccinated.
Okay, what are Abians discouraged?
There are so many stories making the rounds. For instance, some time ago we conducted the yellow fever campaign, and we did that exercise for just 2 weeks. Within 2 weeks, we were able to record over 3 million vaccinations. Over 3 million Abians came forward and they were vaccinated. But for COVID-19, we started 11th day of March 2021. Till now, we are still recording just 27%, So I think it has to do with so many stories that people are spreading all over the place. So that is why they are reluctant. But we are telling them that these things are not true. Anybody that has something tangible, let him come forward and prove it. But those of us that took it, we are still alive today. We've not died. Rather, it's protecting us. That thing the potency is high.
Yes.
So people should embrace it and get vaccine.
Okay, is there any plan by your agency maybe to create awareness, radio, TV, so that our people can come forward and get vaccinated?
Yes, that is part of the strategy. In addition to the town hall meetings we've been having, we want to embark on aggressive media campaign. That will also help us. And we want to use this August meeting to reach out to all the rural communities, we are going to equally engage the services of town announcers. They will help us to spread the good news.
The 2022 World Breastfeeding Day started yesterday.
Yes.
And how is the agency going to mark this year's event?
Thank you. The World Breastfeeding Week is a global event. Everybody is encouraged to take part in that exercise. For Abia State, we have lined up programs of events and activities. We started with interdenominational services conducted in many churches across the 17 LGAs. We have the baby-friendly initiative teams in our various LGAs, so they conducted that. And today, we embarked on media engagement. Then tomorrow we are going to do road show in all the local government headquarters.
Okay.
Then for the state here, we'll do it in Umuahia. So after the road show today, on Wednesday, we are going to all the primary healthcare centers. We are going to conduct routine immunization, antenatal care, and postnatal visits. So when they come, we use that opportunity to spread the good news, to promote exclusive breastfeeding. And then we'll conduct what we call a baby show as a kind of competition that we do. Then on Thursday, that will be the grand finale. First, second, third kids, after the competition from across the LGAs will now converge at Obingwa Mboko, where we have the grand finale. His Excellency, the wife of the governor, will be the guest of honor for that show. And then after that, on Friday, we will equally continue with other activities, and then we round it off on Saturday. That is the program we have for this week, World Breastfeeding Week.
I want you to identify challenges faced by your agency and what you may consider the way forward, the solution to these challenges.
Like every other organization, we have our challenges. For instance, we have issues of mobility devices. Our job is almost always there in the field, and we don't have the needed local machines, motorcycles, cars that we use to carry out what we call supportive supervision. So it's affecting us as well. And then we also have the problem of extinction. Most of our staff are leaving the country. We are having brain drain. You go to a facility today, before you know it, you receive resignation later. What's happening? This was say I'm traveling out of the country. So a lot of I've lost so many of them. They will travel out of the country and then they will. So we've been having shortage of staff in some of these facilities, and we've created awareness. People are now coming to the facility, and when they come, they don't have the needed skilled workers that will attend to them. They feel so bad, and it's really annoying. So we want to address that one too. So some other little, and then some of these, like I said before, there are too many of them. 772. It's not a child's play. So we've been able to renovate, equip these 247 of them. So you see, what is left is still staggering, and yes. We are calling on non-governmental organizations, public-spirited individuals, donor agencies, and government to assist us, so that we will put all these health facilities into proper shape, get the needed equipment for them so that they can perform optimally.
Okay, from what you just said, you are encountering a shortage of manpower, health personnel. Yes, at the primary healthcare centers, and that is as a result of brain drain. Yes. Now, are there plans by the state government and your agency to address that very issue?
Yes, the first one, we have this arrangement of engaging some workers. Okay. We started with what we call temporary engagement. So we've been able to get on board 65 midwives that we've deployed to various health facilities, and we've applied. I know that very soon we will also get over to recruit skilled manpower, nurses, midwives, and doctors. Because what is a situation where at least in every LGA you have one or two medical doctors that will move around and take care of our health challenges.
Okay, can you paint for us an honest picture of Abia State Primary Healthcare Development Agency under your watch? This is your second tenure in office.
I think from available record and statistics, we can beat our chest and say, yes, we are doing fine. We've been able to attract a number of equipment. We've been able to bring aboard so many development partners that weren't here before now. We have the Health Policy Plus, which is an auxiliary or subsidiary of the Bill and Melinda Gates Fund, USAID. We have the TCI. The TCI is an auxiliary of Bill Gates Foundation. We have Maria Stopes. We have the, of course, UNFPA. So all these organizations, UNICEF and WHO, they are here and they are assisting us. So we've been able to equally reach out. Very soon, another group will be here, the Sidani group. We already have the Solina. So some of these development partners are coming because of we have the needed environment and we have robust relationship with them. Another thing we've been able to put on record is this renovation of facilities that we are doing. Then services, there is remarkable improvement in service delivery. Initially, we were recording 78% in immunization coverage, but presently now we are at 91%. In the area of antenatal care, from the last research conducted, Abia State is rated as the state with the highest number of deliveries conducted in the presence of skilled birth attendants. So people now they now have faith in our health facilities and deliveries are conducted there, you know. Yes. So, and then you now look at it, the outbreaks that we'll be having in some other states. They would say Lassa fever, this other time, cholera, you know, some of these things. Because we've trained our workers, they are now at home with the etiology, the pathogenesis and prognosis of diseases. So whenever it is identified, they will detect it and will take proactive measure. So we have our people, we've trained them, we build their capacity. So that is why we've not been having cases of outbreak here in the state. So those who are involved in preventive medicine, like the environmental health officers, they have been able to improve in their services. So we can say that there is reduction according to the last multi-indicator survey, cluster survey, mixed survey conducted. The SMART survey, the lot quality assurance survey conducted shows that there is reduction in maternal mortality. There is equally reduction in infant mortality in the state. And these are very wonderful indicators showing that we are doing well. Our services is now rubbing off, is paying off. The indicators, the data, available data can say, you know. Now, family planning is another area where we've done so well, from the 53% now to 78%.
Okay.
Yeah, family planning uptake. And so, deworming activities, we are doing well in that aspect. Health promotion, we are doing well. So, all the aspects of our services, there is remarkable improvement.
Okay, Doc, can you talk to us on the assistance being rendered by Governor Kesi to your agency?
Yeah, seriously. One, His Excellency the Governor assisted us by paying the counterpart fund of over 100 million naira to the World Bank Group for us to benefit from the Basic Health Provision Fund. Abia happens to be the second state in Nigeria to qualify and to access the fund. So we have, apart from Osun, we have Abia and Niger State, the three states we are choosing as pilot states. He equally paid counterpart fund for us to benefit from what we call Accelerating Nutrition Results in Nigeria. And READ program is a World Bank nutrition intervention program, you know, so in the states. He equally assisted us to bring to the states some of these development partners that I've mentioned. Not only that, the other time we were able to distribute flying boats to riverine communities of Okwa East and West. The governor assisted us to also bring on board, you know, attract these solar direct drives. So each 233 solar direct drives. We use that to preserve vaccines and some other things we use, and each of them is not less than 10 million. So we also have in the state now an incinerator. The governor has assisted us to get we now have incinerators that we can use. Those things weren't in existence before. And I've not forgotten the telehealth initiative. It's linked to all the primary healthcare centers. And so in some of these centers where you don't have doctors, what do they do? When they have a case, they just call, and a consultant will pick the call at the call center and then tell them what to do. It has equally assisted us to improve services. So there's so many things. It goes on and on. So we are really benefiting from the present administration. We've not had it so good.
What has been his scorecard in the health sector?
Excellent. In the health sector, like I said, we've been able to renovate over 200 primary care centers. This is the governor has built so many secondary health facilities. We have the general hospital now at Tumboko. We have the general hospital Ikuano. We have some of these new general hospitals equipped. We also have very soon we are going to commission another one at Umui in Isialangwa. We also have this specialist children hospital that is right behind us here. We've never had anything like that, and there is nothing like that in the whole of Southeast. So His Excellency has that dream, and then the equipment. He has been assisting us to get equipment. Fine. Now we can all equally, say that we have a functional health insurance agency in the state. It wasn't in existence before. So this administration made it possible. Today we have a state health insurance agency. I've not forgotten the emergency medical scheme that is also doing fine. So we've started the Abia Health Village. Very soon it will start functioning. So some of these things are efforts of His Excellency in the area of healthcare delivery that is really paying off.
Now, you said that the COVID-19 vaccination has not been encouraging. It's about 27.5.
Yes.
I think he said so. Now, I wanted to talk to Abians, telling them that the COVID-19 vaccination is safe and healthy.
Thank you very much, distinguished Abians. Please, I am appealing to you. Conspiracy theory has never helped anyone. I don't want us to have the same experience that the Indians had when they refused, to present themselves for vaccination. When the Omicron strain came, it killed them in droves. And very soon, who knows, another strain may come. It is better we protect ourselves now. COVID-19 vaccines are safe, they are potent, they are very, very effective. Please make yourself available. Go to any primary healthcare center, go to any of our major health institutions. Make sure you are vaccinated.
On that note, we have come to the end of today's edition of our current affairs program, Issues of the Moment. We have been discussing with Dr. Chinagozi Adindu. He is the Executive Secretary, Abia State Primary Healthcare Development Agency. He has said so many things, particularly the achievements and challenges facing the agency. And I want to thank you for being part of today's edition of our program. Dr. Adindu, it's a pleasure having you on the show.
Thank you very much.
Thank you for coming.
You're welcome.
My name is Chinagozi Ozems. Join us on Friday for another interesting package of the program. Thank you for watching.